Hey, thank you so much. Good morning, SLO. Again, I'm Keith Aggson. I'm the fire chief here in San Luis Obispo. And this July, we opened and started a new program we're very excited about. It's the Mobile Crisis Unit. This program is based off a similar program in Oregon, which was called the CAHOOTS program, and where we pair a firefighter EMT with a mental health crisis worker, really to be able to respond to and address any type of behavioral health issues and emergencies that our crews and law enforcement may run across. Generally, law enforcement and the fire service respond for persons in crisis within our community with kind of a one-size-fits-all algorithm. The solutions for a broad spectrum of problems ranging from homeless and mental health illness and addiction aren't always necessarily addressed by our personnel. These encounters oftentimes result in law enforcement either citing or arresting individuals, or our fire service personnel, our paramedics, medically evaluating and transporting those individuals to the emergency room where they may not always get the most appropriate and useful treatment. So this new program that we've started up is really about appropriate behavioral health services in the least restrictive manner. So how we implemented the program, because it was really just kind of building the plane as we were flying it, was first sitting down and looking at meeting with our homeless services coordinator in the city, identifying that homeless and housing is a major city goal of the city. And then we met with the city manager. And so City Manager Derek Johnson and our city council provided appropriate resources for us to initiate a 2-year time trial with this program. We also met with several other agencies throughout the state of California, as well as the Denver Star program, to find out how their programs were doing, and to better understand what the challenges, barriers, and best practices would be for the program. We met with our County Emergency Medical Service Administration, as well as the Contract Ambulance Service, to make sure that we aligned our program with current county protocols and policies to stay in alignment with the service that we were providing. We developed our own procedures and guidelines. And, as I stated, we've been from day one, we've been building the plane as we're flying it, as we continue to learn new things and more and advantages to the program that we can harness. We established some program goals, and really it was, this is an alternative to 911 calls for behavioral health service. And this included crisis support, transport to non-medical facilities, and referral services to individuals suffering from mental health challenges, drug and alcohol addiction, and chronic homelessness. We also worked with the SLO PD CAT team and our city rangers to really identify who our high use individuals were and cross-reference those amongst all 3 of our agencies to determine who our priority individuals were for our proactive work. And that's going out and contacting those folks on a regular basis. So a little bit about the logistics on the team. It is made up of 2 members currently. We have a firefighter EMT from our organization, and then we contract a case manager through TEMA. They're trained in crisis intervention, mental health first aid, and de-escalation training. We're staffed Monday through Friday, 8 to 5 p.m. We partner with the SLO Food Bank, with Salvation Army, as well as TEMA, to provide individuals clothing, sleeping bags, toiletries, hygiene kits, and referral services. And that's probably one of the biggest items that's able to come out of this. The team drives a low-profile Ford Transit Connect. You may have seen it through town. It says Mobile Crisis on the back. There's no lights or sirens. And that's really to reduce barriers as much as possible to getting people to accept service. The team also wears polo shirts rather than wearing full uniforms, because we don't want to put anybody on the edge. We want to be as open as possible. So to date, since July 11th, our team has made 263 proactive contacts within our community. They've been dispatched to 110 incidents. So if it meets a certain criteria with an algorithm, they get dispatched out. They can be dispatched out alone, or they can be dispatched out with PD or fire. And then they've also been requested by the police and fire, who are at scene with an individual that was needing assistance. And so our ability to respond out and help assess and possibly turn over that call to our team has been very, very beneficial. We've transported 19 individuals to appropriate services and getting them to locations where they can better be served. And we've reunified 11 homeless individuals with family members. And that's really a big effort and a lot of work that goes in by a wide range of teams. It's just not our crew. It's working with APS. It's working with county mental health to really get these people where they need to be and get them back home. As I mentioned earlier, we looked at our top emergency service users, the people that we routinely go out on over and over, and they tend not to accept service. The team worked with our number one service user, senior female patient who was in very poor medical condition. We were able to reunite her. The team was able to reunite her with her family about 4 months ago, and now she's off the streets living in an assisted living facility in Orange County. So a real big success for our organization. In closing, the Mobile Crisis Unit continues to leverage existing local programs and partnerships to improve availability and accessibility to community members in crisis. And again, just to state, it's not just for the unhoused, it's for the housed as well. So anybody experiencing behavioral crisis. We hope that the future includes expanding of service hours, more of a regional operation where we can expand outside the city, and assistance with funding through San Luis County. So thank you so much for having me here today.